In this talk, I'm going to cover a bit of the background to the dispute in Scotland, most of which should be familiar. I'm then going to talk about the Scottish negotiations, the ballot process, and finally the action proposed, which is different to the action taken in June. Both the UK and the Scottish governments are making major changes to NHS pensions, and we have a complicated situation because some of the changes are in the hands of the UK government, some of the changes are in the hands of the Scottish government, and we'll go into a bit more detail about the differences. One area where the Scottish government had responsibility is employee contribution rates. We've already seen an increase for many doctors of 2.4% in their employee contributions from April 2012, and we're likely to see further increases from 2013 and then 2014, with a total rise of 6% for many members. The UK government is legislating at the moment to end final salary schemes across the public sector and to replace them with career average schemes. The UK government is also legislating on normal pension age and creating a direct link between public sector scheme pension ages and the state pension age. State pension age is going to increase, it's going to go up to 67, 68, and it may go even further than that. Whilst this is in the pensions bill currently going through Westminster, the Scottish Government is still trying to seek confirmation as to whether it can do anything different on this issue in Scotland.
Protection arrangements do apply in relation to the ending of final salary schemes and the increase in normal pension age. These arrangements mean that those within 10 years of their current pension age will not be affected by those particular changes. For example, if you are in the 1995 scheme, most members would have a retirement age of 60, and therefore members over the age of 50 would not be directly affected. However, all members will have to pay increased employee contributions. In 2008, doctors accepted higher and tiered contributions for all and a higher normal pension age for new entrants of 65. Docs agreed to those changes, giving staff and not taxpayers sole responsibility for covering future increases in costs. The NHS scheme is currently still providing a surplus of contributions received over benefits paid of around £1 billion per year. Furthermore, doctors have to pay proportionately more for their same pension as some other public sector workers. And it's because these changes were agreed as recently as 2008 that doctors are particularly angry that only 4 years down the line further considerable changes are being made to their pensions.
We held a ballot in May 2012 and we had a strong turnout and vote in favour of action across the UK. Approximately 50% of members voted. Most were strongly in favour of the action proposed at that time. The number of members voting in Scotland was higher than the average across the UK by around 12%. And the level of support for action was higher by about 6%. On the 21st of June 2012, doctors undertook a day of urgent and emergency care. We asked doctors to go to their workplace. This was a softer form of action with a focus on patient safety.
Participation in the June Day of Action was particularly difficult to assess because of the nature of the action taken. However, official Scottish Government statistics estimated that around 3,200 outpatient appointments and 450 inpatient appointments were cancelled on that day. Our feedback suggests that there was possibly a higher impact still than this. After reviewing the Day of Action in June, the BMA suspended further industrial action at UK level. The BMA decided instead that it would engage in talks over employee contributions for the England and Wales scheme and the Working Longer review, which is looking at the impact of the increase in pension age on different groups of staff. The BMA is also continuing to campaign for improvements over pensions. For example, the BMA is going to work with Unison and the RCN to develop a joint campaign focusing on maintaining the NHS pension age at 65. BMA is also focusing heavily at the moment on lobbying on the Public Service Pension Bill, which was recently introduced in the UK Parliament and it's proceeding now. However, there really is no genuine political opposition to the bill at Westminster.
We've had Scottish level negotiations ongoing since May 2012. There's been a regular series of meetings, but there has been little progress in those negotiations. That's led to a great deal of frustration, and particularly because there is a lack of clarity over what can be discussed at Scotland level. It is clear that the Scottish Government has some latitude, and in particular it can negotiate over increases in contribution rates. However, we still don't know whether we're going to be able to discuss the link between normal pension age and state pension age. The Scottish Government did introduce changes in April 2012 to employee contribution rates, and further contribution rates are likely in 2013 and 2014. The BMA Scottish Council asked the UK Council for a fresh ballot, given the context is different in Scotland. This particular dispute relates only to Scotland, and the focus of the dispute is with the Scottish Government. The aim of this dispute is to seek meaningful concessions from Scottish Government, and as already mentioned, employee contributions in particular is the one area that we're focusing on. This will be a ballot only of secondary care doctors. GP Committee in Scotland took soundings from its members and from local medical committees, and there was limited support for strike action. Therefore, GPs are being excluded at this time.
There is no live industrial action over pensions in the NHS at UK level, with all unions participating in talks. Following on from the NHS Day of Action in November 2011, there have been various UK ballots and member surveys undertaken by other unions at UK level, but no union felt that they had a mandate to continue action. They have therefore effectively accepted the England and Wales pensions offer. In Scotland, the NHS unions are, like the BMA, participating in negotiations, again including Unison and the RCN. All of those unions share the BMA's frustration at the process. However, there are no current plans for further action either at Scotland-only level.
The ballot's going to open on the 6th of November. It's going to close at 8 a.m. on the 28th of November. As before, it's going to be a postal ballot only. This is prescribed in law. We took the unusual step of announcing the days of action very early in the process, and we've announced 3 dates: the 12th of December, the 8th of January 2013, and the 17th of January 2013. We're proposing a different form of action to that taken in June. It's deliberately intended to have a stronger impact. This is strike action with emergency cover. We've set 3 dates, and more might be required. In this form of action, doctors would not go to their normal place of work and would not be performing any work except for fulfilling their emergency duties. Whether this is on call from home or working for the hospital, and it will differ on a specialty and departmental basis. We would expect most departments to reflect their regular on-call arrangements, for example, for a weekend or public holiday. However, it's important to be aware we cannot insist on this type of service, as an employer may choose to run whichever service it sees fit. This will be clearly defined as strike action for most doctors. However, some doctors would be providing emergency cover. And because doctors may be providing emergency cover, we have to put 2 questions on the ballot paper, as we did last time. Most members will be on strike. Some members won't be striking, but may be adjusting their working pattern. For example, being on call from home instead of doing routine work. These members working differently to normal could in effect be taking industrial action short of strike action. Therefore, for maximum legal protection, we need to ask 2 questions, as in the previous ballot. If we want to take the action proposed, we need members to vote yes to both questions on the ballot paper. We're strongly recommending that members vote yes to both questions. We have considered other forms of action and don't think anything else is viable. It's this or nothing. As already indicated, we've announced the dates well in advance so employers can plan. Employers may well not do much before the ballot result is announced, but we've given them every opportunity to plan ahead. Time will be relatively tight between the result announcement on the 28th of November and the first day of action taking place on the 12th of December. We will seek to have national discussions with employers. In June, we agreed a set of national principles to define the action, and we will seek to do so again.
We are asking local negotiating committees to have discussions with employers around emergency cover arrangements in particular. This also happened during the June Day of Action. Some employers were reluctant and may well be again to have discussions with the BMA. However, by attempting to negotiate with employers, we can demonstrate attempts to limit the disruption to patients.
Colleagues will need to be clear about who will provide emergency cover and how. It's important from a legal and a GMC perspective that everyone is clear who's providing cover. This may well be obvious for some specialties and departments. For example, if someone is rostered to be on an emergency on-call rota in the hospital in the daytime, that would probably be the person to be on call on a strike day. May not be quite so obvious for some specialties, and there may need to be discussion between colleagues and with management.
The BMA will review the impact of the action after each day of action has occurred, and the UK Council has set up a mechanism specifically to undertake this task.
What do we want? Well, we definitely want members to vote yes to both questions. As I've already indicated, we cannot take the action without a yes to both. We think that getting a yes vote and taking this action is the only realistic prospect we have of getting genuine concessions from the Scottish Government. We also need to put down a marker against future challenges. We need to demonstrate that there will be a reaction to changes that have a significant impact on members, and doctors will not take these kind of changes lightly. Whatever your view, we need a high turnout in this ballot to give us a clear decision, so please do vote whatever your decision.
If you do vote yes in the ballot, we need you to be prepared to follow that up by taking action. It's very important for the BMA to be able to get a yes vote in the ballot, but it's equally, if not more important, that that is backed up by members actually following through and taking that action.
In terms of pay, it's highly likely that your employer will deduct a day's pay if you participate in action. It's going to be much more clear-cut this time than it was in June, where some employers chose not to deduct pay. In terms of indemnity, the defence bodies reassured us in June that cover would be provided as normal, and we're seeking similar assurances this time around. Many members are concerned about possible referrals to the GMC. We're not in a position to say that fitness to practice referrals will not be made. The GMC is unable to give us any broad advice other than to say that cases will be considered on an individual basis in line with normal procedure.
We know that this is an area that matters greatly to doctors. It was clear from feedback at meetings early in the year and from survey work that we undertook after the first day of action. We want to reassure members that we are extremely active in this area. However, it's important to realise that the public are not necessarily unsupportive of the doctor's case. Ipsos Mori undertook some public research for the BMA after the 21st of June day, and the public across the UK remained supportive of doctors in the dispute. 49% of the public are supportive of doctors, as opposed to 29% supportive of the government. 70% of the public responding had not changed their opinion of doctors as a result of the day of action. We do realise that the media is much more hostile than the public. Following the June day of action, there was a consistently hostile editorial comment, particularly at UK level. As indicated previously, we were and we will be active in putting our own point of view across, for example, taking out adverts, but we do need to recognise that the media is likely to remain hostile. We will continue to brief widely. For example, we have been meeting with politicians, patient groups and journalists. Indeed, there is some political sympathy in Scotland, such as amongst the Scottish Labour Party, and we will continue to brief politicians in advance of any further day of action. However, despite all this work, we need to accept that there will be a hostile environment, particularly given that this will be strike action. Please make sure that we have your workplace details. As before, we need to do everything possible to make sure that details are up to date, otherwise we're open to legal challenge. This time around, we are not balloting members without workplace details, so please update us during the course of the ballot if you haven't already provided those details. We also want you to make contact with your local negotiating committee to discuss planning. We've already covered this above. Please also discuss with colleagues what emergency cover arrangements would be necessary in your department. Importantly, we want you to raise awareness amongst your colleagues. Many colleagues will have been to meetings or read this particular presentation, but please pass on the message to everyone who could be affected by the dispute. Please look out for the ballot pack. The envelope will be arriving on your doormat from the 6th of November, and as before, it will have a distinctive blue strip. Please make sure you vote, and please vote as early as you possibly can. And please remember, we need you to vote yes to both questions. For more information, please continue to look at this website as we continue to update with further FAQs and information. And if you have any specific questions or advice, these are the email and telephone details.